I was quite scared about the whole thing and couldn't find anything online from somebody who'd been through it. So here goes with my experience, which might help somebody else. It all started 12 years ago. I was having a lovely meal when, for no reason, a lump of meat, usually beef, got stuck in my gullet. I would have to make my excuses and go outside, and I'd wander around trying to get rid of the blockage, and it would sometimes take over an hour for a bit of the meat to go down, and after getting a bit of the meat to come up. It was a very, very nasty experience. I couldn't swallow any saliva, couldn't swallow any water. It wasn't life-threatening. I could still breathe, but it was very embarrassing. Age 76, I hadn't been to a doctor for 10 years or more. And one day, just out of the blue, I decided to make an appointment to have an MOT. I had 10 things that bits were dropping off me. And I thought I'd just go and see a doctor and put them all to him and see what he could come up with. After 6 weeks of waiting to make the appointment, for the appointment to come, I went to see the doctor and I started to explain my 10 things that were wrong. And he said, "Oh, no, one at a time. And I said, well, it took me so long to get this appointment. If I do it one at a time, it'll be 5 years before I get to the last one. And he just didn't see the humour in that at all. Anyway, I chose food getting stuck as the first problem. And he sent me off to arrange for a specialist to look down my throat, which was a horrible experience, gagging, awful experience. A few weeks after that, I got a call to see the doctors at the hospital and went into the room where there were 6 medics all grouped around, and the doctor explained in some length the result of my biopsy. I said, after not really understanding what he was saying, I said, "Do you mean cancer?" And the look on relief on their faces that I'd said the dreaded C word first before they had to was quite palpable. It must be awful for them to have to tell people that they've got cancer every day. But the doctor spelt out my options, which were to do nothing and I'd probably die, or have chemo and an op to remove my gullet, which had a 75% chance of success, to live for 5 years, assuming I was fit enough to have the operation. I chose the latter. I did think that if the tumour had been around for at least 10 years, then maybe it would go for another 10 years and I'd be dead anyway from old age. Then again, poking around to get the biopsy might have stirred the dragon into life. So decisions needed to be made. A few weeks later, I was called to Chelmsford to see the anaesthetist for a health checkup. It was very bad for statistics to die on the operating table. He used the NHS high-tech communication systems by banging on the wall to summon his nurse from the next room. I followed her into her torture chamber and rode on a bicycle plugged in with numerous wires from my chest and a tube in my mouth as I cycled my way theoretically uphill until such time as I was totally fagged. After that, the results went next door, and I went back to the anaesthetist, and he said he was happy with the result and that I was fitter than many for my age, which was quite nice to hear. But I could do better with increasing my lung capacity. So I was given a Tonka toy, as I call it, to practice with to improve my lung capacity. Quite soon after, I started my chemo sessions, 4 sessions of FLOT treatment, F-L-O-T, over a 2-month period. On a bank holiday Sunday, yes, they work hard in Colchester, I was fitted with a line. This is a small tube, 20 inches, 50 centimeters long, that is inserted under the armpit here and goes up through a vein down to near the heart. This is connected to the pump that pumps the chemotherapy chemicals into you. It's left there in situ for the 2 months that the chemo session lasts, and it saves having to put cannulas into your hand every time you have treatment. So it in fact was the better way to go, and certainly more convenient for the nurses. Into the chemo session, the chemo ward, at 9 o'clock the next day, at 8 o'clock the next day, and they started to connect me up to the pump at 9 o'clock and went through the F, L and O sequence of chemicals for the next 8 hours. And then at about 5 o'clock, they connected up the T final chemical into which was in a bladder, which was then connected up to my my line, and this bladder was then put into a belt tied around your waist, and you were sent home for a 24-hour infusion of this chemical. A bit uncomfortable to sleep with, but anyway, the next afternoon one went in and they removed it, having finished the infusion. Another unpleasant job was to inject your tummy with some drug every day. If you feel a bit squeamish about it, they will organise a district nurse to come along and give you the injection. It reminded me of army days where we would butcher each other trying to give morphine injections to each other as a practice. Happy days. I felt fine the first day or so, but by the end of the week, I was feeling pretty rough. Then over the next week, feelings improved until I was ready for the next week, when the whole sequence started again. And this went on for 4 sessions, 2 weeks lasting each session. The nurses were fantastic in the ward, and they worked so hard, hardly sitting down the whole day. I was so impressed with them. I gave them a box of chocolates each when I had finished my session with them. The list of symptoms in the chemo brochure that you're given list just about every ailment known to man. For me, I lost a little bit of hair, not so that you would notice. I lost my appetite. I had no taste for tea, coffee, or alcohol. But really, those were the only symptoms that I had. Oh, and if you got a bottle of milk out of the fridge, you had to concentrate hard to stop dropping it. But really, I came off pretty light. A couple of weeks later, I was back to normal, up at 7 o'clock, making breakfast for my wife in bed, walk the dogs, cycle to the post box, a bit of golf, a bit of sailing, mow the lawn, bit of gardening, pretty much normal. I then had another fitness test with the anaesthetist and after chemo, and he was happy, but insisted that I still try and improve my lung capacity. So I had to practice that more. He was happy that I'd lost 15 kilos over my chemo therapy treatment, but I had a fat tummy, so there was still plenty more to lose. A meeting with the surgeon answered several of my questions. He explained that the esophagus had blood vessels at the top and the bottom, and so for the joint to heal, the whole esophagus had to come out. My stomach would then be located behind my lung, and I would have no valve to stop stomach contents from coming up into my mouth. So therefore I would have to sleep sitting up and never let my head go below my chest. Apart from that, did I want to go ahead? Sign here. Quite soon after I got the call, they were ready to cut me up. A quick blood test to confirm my blood group, and then a new experience for me, an epidural. The anaesthetist took some time to count down my vertebrae until he was happy with the right one, and then quite a hard push to get the needle in. After that, my mind was blank. I woke up in the recovery ward with the guy in the next bed swearing like a trooper, and his nurse was saying, "Watch your language, there are ladies present." I was having the most marvellous sensations under the influence of morphine. I can now understand why people take drugs. At times I was floating above the bed in a blaze of colours, quite beautiful. For some reason I was trying to do some keep fit exercises. Next I was in a foreign land, marvelling at my colourful surroundings. It was all quite bizarre. I next woke up in a 4-bed ward and surveyed my body. 2 drips feeding into cannulas in the back of my left and right hands, another cannula in my neck, another drip feeding my epidural, a bag with a pipe disappearing up my nose, a bag with a pipe disappearing up my penis, another bag with a 12mm diameter pipe draining the wound in my back, several sewn up holes in my chest and stomach that were used for keyhole surgery, a half a dozen wires from my chest plugged into a computer, and finally oxygen piped up my nose. The most painful of these was the pipe sewn into my nostril, of the pipe that went down my nose and into my stomach. I now know how a bull feels when his ring in his nose is pulled. It was excruciatingly painful. A nurse explained how the buttons for the bed worked, and another button to call a nurse if I needed help at all. And after a couple of days, the surgeon came by and just to check how I was. Was I in pain? And I said, well, yeah, a bit, but I can handle it. And he said, are you pressing the magic button? And I said, well, no, I didn't really want to trouble the nurse. And he said, you mean you've been 3 days without painkillers? He said, the magic button doses the morphine into your epidural. Oh, I thought it just called a different nurse to give me a jab. Coughing was painful, and the surgeon said it would be the ribs that got in the way when he was rummaging around. He said they're very thin and very easy to break, and probably got cracked moving them out the way. Very casual about it. He said the right lung was troublesome, getting it to reinflate after the op. And a few days later, I got pneumonia in it, but that was soon knocked on the head by drugs. Several months later, I got pneumonia in it again, and then a couple of years later, I got pleurisy in the right lung, which is very, very painful. I wouldn't wish that on anybody. The tough part of the recovery process was nil by mouth for a week. Not eating for 7 days didn't worry me, but the thirst was terrible. I was allowed to have a little foam lollipop moistened with water to moisten my lips, but that was all until the first drink that I had was blue dye, which I had to swallow, followed by an x-ray to see if the joint in my gullet was watertight. I heard nothing to the contrary, so I assumed that was successful. The other memorable thing was when I asked, have I had a movement? And I was then explained that this was nurse speak for have I had a crap? After a few days, it took 2 nurses to unplug me from all the various bits of equipment and bags and things. And I shuffled off to the loo with all the bags pinned to my nightie. And my first movement was in A major, black diarrhea, an enormous explosion of it. A few days later, I didn't make it, and I caught my cannulas dangling from my hand into the various pouches and containers pinned to my nightie, and before I could sit down, I let go and messed all over me, all over the loo and all over the floor. A hell of a mess. The nurses were brilliant about it and quite unfazed. Overall, the NHS, National Health Service, was very good. The nurses were fantastic. The only downside was the food, which was totally inedible. And the hospital pharmacy took 3 days to put my home-going drugs together, which were the same drugs that I'd been having all week. After 10 days in the hospital, my weight had gone down down to 95 kilos. So overall, with chemo and the operation, I'd lost 25 kilos, which was no bad thing for me. Presently, I'm 105 kilos, so I put on a bit more weight, but for a 6'1" man, 80-year-old, I suppose that's not too bad. The biopsy of the removed tumour revealed no cancer cells at all. So the chemotherapy had really done a good job, and maybe I didn't need the operation after all. Lymph nodes were clear, 0/15, and I was clear of any cancer elsewhere. My life has changed after the op. Lunch is now my main meal of the day, and the meals are smaller. In a restaurant, I would ask for child's portions if they were available. Initially, an orange or a grape would make me vomit. But after 4 years, I can eat anything. Occasionally, if I eat too much, I'll feel sick, but I can usually control that and control the urge to vomit. I hate to lose a good meal. Sometimes, for no reason that I can see, a meal goes straight through me, and a quick rush to the loo is needed. I drink about 4 pints of water a day, orange juice. To be sociable, I drink tea, coffee and alcohol, but I derive no pleasure from it. That from a man who used to enjoy his gin and tonic every evening. I sleep propped up, which I'm now getting used to, but it's not easy. I sleep with a bolster under the mattress and 4 pillows on top, and this props me up to an angle of about 30 degrees. However, during the night I can slip down. Usually I wake and hoik myself back up again, but if I don't do that, I then wake up with a start, with coughing with a mouthful of vomit and bile and going down into my lung, and having to hell of a job coughing it up, and then my windpipe gets extremely sore from the acid burning the side of it. So it's not very pleasant at all, and takes me a hell of a long time to get back to sleep again. I was a bit wary of travelling, but I found that if I took 2 pillows with me, the usual 2 pillows in the hotel and another 2 on request, and that seems to do the job. So, in conclusion, my cancer experience has not really changed my life to any great extent, and most of the point, I'm still alive. At the beginning of my experience, I received a phone call from a very good friend of mine who said, "I want you to hear it from me rather than through friends and the grapevine, that I've been told I've got esophagus cancer." I said, "Good heavens, snap. So have I. I've just been diagnosed with esophagus cancer." 6 months later, I went to his funeral. It makes you think.